I think about this question a lot. What is veterinary medicine going to look like in 2035? Because I don't think the biggest change is going to be a new drug or a new surgical procedure or even artificial intelligence. I think the biggest change is going to happen when several technologies that already exist begin working together. AI, wearable sensors, computer vision, continuous patient monitoring, precision medicine, new biologically targeted therapies, and enormous amounts of patient data. Now, individually, none of these ideas is completely revolutionary anymore, and AI is already analyzing radiographs, and dogs are already wearing activity monitors, and we're already sequencing tumors. We're already using monoclonal antibodies to treat disease. But imagine what happens when all of those technologies start talking to each other, because that could fundamentally change not only how we diagnose disease, but what it actually means to be a veterinarian. The veterinarian of 2035 may spend much less time asking, what disease does this animal have? And much more time asking, what do I actually do with everything technology just told me? And that distinction is incredibly important because I don't think technology is going to make veterinarians irrelevant. I think it is going to change which parts of being a veterinarian are actually valuable. So let's talk about AI. AI will move beyond just reading x-rays, and let's start with that. So when veterinarians hear AI, most of us currently think about diagnostics. Reads an x-ray, evaluates a cytology slide, analyzes an ECG, maybe looks at a gait pattern, and we're already seeing all of those things. But I actually think that's probably the least interesting version of veterinary AI. Because right now, we're mostly asking AI to perform relatively isolated tasks. Here's an x-ray. Tell me what's abnormal. Here's a cytology slide. Tell me what cells you see. Here's an ECG. Tell me whether there's an arrhythmia. Useful? Absolutely. Transformative? Not really. The real transformation happens when AI stops analyzing one test at a time. So imagine I have a 10-year-old Labrador named Max. Max has been coming to my hospital his entire life. Instead of an AI simply looking at Max's radiographs, imagine it has access to his entire medical history. 10 years of medical records, 5 years of laboratory results, every radiograph he's ever had, his medications, his body weight, his body condition scores, activity data from his collar, resting heart rate, sleep patterns, maybe even videos showing how Max moves around his house. Now, I'm not asking, is there arthritis on his x-ray? I'm asking, what is happening to Max? And that's an entirely different question. Maybe Max activity has fallen 12% over 6 months, and his nighttime movement has increased, and his walking speed has gradually decreased, and his weight distribution between his pelvic limbs has changed, his resting heart rate has slowly increased, and maybe several laboratory values have started drifting. They're still technically within the reference intervals. Nothing has a giant red H or an L next to it, but the pattern's changed. As a veterinarian, looking at those things individually, I might not notice anything. An algorithm analyzing thousands of variables longitudinally might. And that's where AI becomes really interesting. Not simply replacing a radiologist, not replacing a pathologist, but identifying relationships between enormous amounts of information that a human being simply cannot process simultaneously. Another thing, we may diagnose disease before animals even look sick, and that leads to what I think could be an even bigger change. Veterinary medicine may become much less reactive. Think about how veterinary medicine works today. Something changes, the owner notices, they make an appointment, the animal comes into the hospital, we perform an examination, we run diagnostics, and eventually we identify the disease. But there's an enormous weakness in the system. The owner has to notice something first. And animals are remarkably good at hiding disease. Osteoarthritis is a perfect example. Owners frequently tell me, my dog isn't painful, but what they usually mean is my dog isn't crying. Meanwhile, the dog stopped jumping into the car 8 months ago. It hesitates before climbing stairs. It's sleeping more. It doesn't follow the owner upstairs anymore. Its walking speed's decreased. And maybe it's shifting weight from one limb to the other. Those are potentially meaningful changes. They're data. We haven't historically had a good way of continuously measuring those data points. That's changing. Wearable devices can monitor activity. Pressure sensitivity systems can objectively measure gait. Computer vision may increasingly allow us to analyze movement from ordinary videos. Smart collars can monitor activity and sleep, and some technologies are exploring physiologic measurements like heart rate and respiratory patterns. So now imagine combining those measurements longitudinally. Instead of waiting until Max is obviously lame, an algorithm recognizes a progressive gait change 3 months earlier. Or imagine a cat. Instead of waiting until the owner notices that the cat has lost 2 pounds, technology recognizes that over the last 3 months, food intake has slowly changed, activity has changed, body weight is declining, litter box behavior has changed, maybe water consumption is changing. Individually, none of these changes screams disease. Together, they might. Veterinary medicine potentially moves from your pet has disease to your pet appears to be developing disease. That's a profound change. Another thing, the physical exam may extend into the home. There's another strange limitation of veterinary medicine that we almost never talk about. I examine an animal for maybe 10 minutes, and from that snapshot, I'm supposed to understand what's happening in that animal's life. But there are more than 500,000 minutes in a year. I see maybe 20 of them. For the rest, I'm essentially blind. That's why veterinary medicine depends so heavily on caregiver observation, and we ask, how is he walking? How much is she drinking? Is she sleeping normally? Has his activity changed? Is she eating? And owners do the best that they can, but human observation is subjective. We don't remember exactly how fast our dog walked 6 months ago. We don't know whether our cat drank 15% more water this month. Gradually, the changes are particularly difficult to recognize because we see our animals every day. Technology could give us something completely different. It's what I would almost call a continuous physical examination. Not literally, but functionally. A wearable recognizes that activity has decreased, and a camera detects that stride length shortened, and a smart feeder recognizes decreased food intake, and a connected scale tracks body weight. A litter box identifies changes in frequency, body weight, or elimination patterns, and software integrates those signals into the veterinary record. Suddenly, the examination isn't only happening inside the hospital, it's happening between visits, and potentially the reason you came to the veterinarian changes. So instead of the owner saying, something seems wrong with my dog, the veterinary hospital may contact the owner and say, we're seeing a pattern in your dog's data that we think we should investigate. That's a completely different model of medicine. Another thing, our objective measurement could transform pain medicine. I think this could be particularly transformative for pain because pain is incredibly difficult to measure in animals. Our patients can't tell us, my knee hurts 30% less today. So we use proxies, owner questionnaires and veterinary examinations, force plates, activity monitors, gait analysis, and every one of those tools has limitations. Owner questionnaires are incredibly useful, but they're subjective. Veterinary examinations are snapshots, and force plates are objective, but they're generally performed in controlled environments. Activity monitors tell us how much an animal moves, but not necessarily why. Now imagine combining several measurements continuously. Instead of asking, does your dog seem better? I can tell you walking speed increased by 14%, and daily activity increased by 18%, and nighttime restlessness decreased. The left to right weight bearing asymmetry improved, and the dog is climbing the stairs more frequently. Now we can start asking much better questions about treatment. Did the NSAID actually help? Did the monoclonal antibody help? Did the supplement help? Did rehabilitation help? Did surgery help? And importantly, how much did it help? That has enormous implications, not just for clinical medicine, but for research. Because anyone who studies veterinary pain knows about the caregiver placebo effect. If an owner believes their dog is receiving an effective treatment, their percentage of improvement changes. That's not dishonesty, that's human psychology. But objective longitudinal measurements could give us another layer of information. It's not simply the owner thinks the dog is better, but the dog is objectively functioning differently. And the ability to measure that continuously could change how we evaluate therapies. Here's another big one. Precision medicine is coming to vet med. For most diseases, veterinary medicine still largely treats patients based on a diagnosis. The dog has lymphoma, it has a mast cell tumor, it has osteoarthritis. Therefore, here are the treatments we generally use. But biologically, two animals with the same diagnosis may have very different diseases. Oncology has already taught us this. Two tumors can look relatively similar under a microscope but have very different molecular characteristics. Those differences may affect how aggressively they behave, their likelihood of metastasis, and potentially which therapies they're most likely to respond to. We're already beginning to think beyond simply naming the tumor. Over the next decade, I think we're going to increasingly stop asking, what drug treats this disease? And we're going to start asking, what treatment is the most likely to work in this patient? That's precision medicine. And it could involve molecular diagnostics. It could involve genomics and tumor profiling and biomarkers and pharmacogenomics, potentially even information about an individual animal's metabolism or immune system. And oncology is probably going to lead this because cancer is inherently a disease of altered biology. But I don't think it stops with cancer. Imagine being able to predict which dog is likely to respond to a particular osteoarthritis therapy, which patient is at increased risk of an adverse drug reaction, which dog metabolizes a medication differently, which patient is likely to develop a particular disease years before clinical signs appear. We're nowhere near having all of those answers today, but that's the direction that medicine is moving. Another point, the drugs themselves may become smarter. At the same time we're getting better at characterizing patients, therapeutics themselves are changing. Traditional pharmacology often involves blocking something. It blocks an enzyme, it blocks a receptor, it blocks an inflammatory mediator. But newer technologies are becoming much more biologically targeted. Monoclonal antibodies are already increasingly important in veterinary medicine. Cancer immunotherapy continues to evolve. Gene therapies are being investigated. Regenerative medicine continues to evolve. And one technology I find particularly fascinating is targeted protein degradation, including something called PROTACs. PROTAC stands for proteolysis targeting chimera, and the concept is fascinating. Instead of simply binding to a problematic protein and blocking what it does, you're essentially recruiting the cell's own protein disposal machinery to get rid of it. In very simplified terms, don't inhibit the protein, remove it. Now, whether PROTACs specifically become important in veterinary therapeutics remains to be seen, but that's almost besides the point, because they illustrate the broader direction that pharmacology is heading. More specific targets, more sophisticated mechanisms, more individualized therapy. And now think about what happens when that converges with precision diagnostics. Better characterization of the patient, better characterization of the disease, more targeted therapies. And algorithms potentially helping you determine which therapy has the greatest probability of success in any particular patient. This is very different from traditional one-size-fits-most medicine. Here's the part that worries me. Everything I've described sounds incredible, but there's another side to this. Veterinary medicine has always been attracted to new technology, new implant, new drug, new diagnostic, new supplement, new device, new surgical technique, and now new algorithm. But there's something we have to remember. Innovation and evidence are not the same thing. Something can be technologically impressive and clinically useless. An AI system can produce an incredibly confident answer, but that doesn't mean the answer is correct. And we're already seeing where veterinary AI studies, where the headline sounds incredible, you read the abstract and you think, this thing is better than veterinarians. Then you look at the methodology and it's a small data set, no internal validation, no independent external testing, highly selected patients, specialized equipment, and sometimes endpoints that don't reflect how the technology will actually be used in practice. That doesn't mean the technology is bad. It means we have to ask better questions. Was the algorithm independently validated? Was it tested on patients that actually resemble the animals in my hospital? What happens when the radiograph isn't perfectly positioned? What happens when the patient has multiple diseases simultaneously? How often is the system wrong? And even more importantly, how is it wrong? Because false positives and false negatives don't necessarily have the same consequences. If an AI misses something important, that's obviously a problem. But if it generates enormous numbers of false positive, that creates another problem. It creates more tests and more biopsies and more cost to the pet owner and more anxiety and potentially unnecessary treatment. So accuracy by itself doesn't tell me everything I need to know. And there's another issue, automation bias. When a computer gives us an answer, humans have a tendency to give that answer credibility, especially when it's delivered confidently. Think about your GPS. You can know perfectly well where you're going, but the second your GPS tells you to turn left, there's a tiny part of your brain that thinks, maybe I should turn left. Now imagine that instead of directions, the computer says, there's a 93% probability of pulmonary metastasis. How much does that influence your interpretation of the radiograph? So one of the greatest risks of veterinary AI may not be that machines make mistakes. Machines are going to make mistakes. Veterinarians make mistakes. Everybody makes mistakes. The danger is that we stop questioning the machine. Now, will AI replace veterinarians? Now that brings us to a question everybody asks. Will AI replace veterinarians? I don't think that's actually the most useful question because parts of what veterinarians currently do probably will become automated. Pattern recognition is an obvious example. Computers may eventually become better than humans at identifying certain abnormalities in medical images. They may detect patterns in laboratory data that we just missed, and they may recognize subtle gait abnormalities earlier than we can, and that's okay, because diagnosis is not the same thing as medicine. So let's say an algorithm tells me there's an 80% probability this dog has disease X. Great, now what? Should I perform another diagnostic test? Which test? Should I treat now? Should I wait? What happens if the algorithm's wrong? What happens if I do nothing? How does the dog's age affect that decision? What other diseases does this patient have? What medication is it taking? What can the owner realistically afford to do? What outcome actually matters to this family? How certain do I need to be before recommending surgery? And what happens when the computer's recommendation conflicts with everything that I'm seeing clinically? Those aren't simply pattern recognition problems. Those are judgment problems. And I think judgment may become one of the veterinarian's most valuable skill sets. I think where this is going is that the veterinarian may become the interpreter of technology. Think about veterinary medicine 50 years ago. Veterinarians had relatively little diagnostic information compared with what we have today. Today we have an enormous amount. Tomorrow we may have too much. Imagine opening a patient's record and seeing continuous activity data and sleep data and heart rate records and respiratory rate trends and weight trends and gait analysis and lab trends and imaging findings and AI-generated differential diagnoses and risk scores and genomic information and drug response predictions and potential disease alerts and thousands of data points. The problem is no longer how do I get more information? we're exhausted. The problem becomes which of this information actually matters, and that's where I think the veterinarian's role changes. We become less valuable as repositories of medical facts because, let's face it, no human being can compete with a computer at storing information. Trying to memorize more facts than AI is a losing strategy. Instead, our value becomes something different: understanding context, recognizing uncertainty, evaluating evidence, identifying when the data just doesn't make sense, and communicating risk, and understanding the patient and understanding the pet owner, and balancing benefit, harm, cost, and quality of life, and making decisions when there isn't one obvious correct answer. Ironically, the more technology enters veterinary medicine, the more valuable those human skills become. I mean, there's another issue here that we need to start discussing now. If my dog's health collar is collecting data 24 hours a day, who owns it? The owner, the veterinary hospital, the company that made the collar? What if that company uses the data to train an algorithm? What happens if the company disappears? Can another veterinary platform access that information? Can I move 10 years of data into a different medical record system? And what happens when an algorithm makes a recommendation? Do I know why? Because if technology becomes deeply embedded in clinical decision making, veterinarians are going to need some understanding of how those systems were built. Not the computer science, but the clinical limitations. What population trained the model? Which animals were excluded? What outcome was it designed to predict? And does that outcome actually matter to my patient? The veterinarian of 2035 may need to understand data quality almost as much as the diagnostic test quality that we are used to using. Another question I have is, what happens to the veterinary appointment? I also think the veterinary appointment itself could change. Today, a huge amount of appointment is devoted to gathering information. What's been happening? When did it start? Is your dog eating, drinking, vomiting, limping? Does it have diarrhea? Is it sleeping normally? Imagine if much of that information is already available before the patient walks through the door. Maybe before the appointment, I receive a summarized timeline. Activity decreased 10% beginning 6 weeks ago, and body weight declined 4%, and nighttime respiratory rate increased, and my medication compliance is 92%. Video analysis suggests progressive right limb asymmetry. Now, instead of spending the first half of the appointment trying to reconstruct what happened, we can spend that time talking about what we're going to do about it. That may actually make veterinary appointments much more personal, not less, because technology handles some of the measurements and the veterinarian spends more time interpreting, explaining, and helping the owners make decisions. So the biggest innovation here may not be technology. If you ask me what is the biggest veterinary innovation coming in the next 5 to 10 years, I don't think it's AI, I don't think it's wearables, I don't think it's genomics, I don't think it's a new class of drugs. I think it's the convergence of all of them. Imagine a patient whose health is continuously monitored at home. Subtle changes are detected before clinical disease becomes obvious. AI integrates those changes with years of medical records, laboratory data, imaging, and genetics. The veterinarian receives an alert. We investigate earlier. We diagnose earlier. And then we select a therapy based not simply on the name of the disease, but on the biology of that individual animal. And after we start treatment, we continuously measure whether it's actually working. That's a fundamentally different model of veterinary medicine. It's shift from episodic medicine to continuous medicine, from reactive medicine to potentially predictive medicine, from treating populations towards treating individuals. But there's one enormous condition attached to everything that I've just described. We have to prove that this works. Not in a technology company's demonstration, not in a carefully selected data set, not because an algorithm produced an impressive accuracy number. We need prospective studies, independent validation, real-world clinical populations, comparison with existing standards of care. And ultimately, we need to demonstrate that these technologies don't simply generate more information, they produce better outcomes for our patients. Because innovation should never be measured by how impressive the technology is. It should be measured by whether our patients are better because we used it. And I think that's going to be one of the defining challenges of veterinary medicine over the next decade. Technology is going to become extraordinarily good at giving us answers. Our job will be making sure we're still asking the right questions. So I want to hear from veterinarians, veterinary technicians, researchers, people working in the animal health industry, and pet owners. What technology do you think is actually going to change veterinary medicine the most over the next decade? Is it AI? Is it wearables? Is it precision medicine? Is it gene therapy? Is it a new cancer treatment? Is it going to be continuous monitoring or something completely different? Put it in the comments, because I'm going to take several of these technologies into deeper dives individually. Not just what companies say they're capable of doing. I want to look at the actual science. What's real? What's hype? What are the limitations? And what might genuinely change the way that we practice veterinary medicine? Because veterinary medicine in 2035 is going to look different, no matter what. The interesting question is whether we're going to use these technologies simply because we can, or whether we're going to demand evidence that using them actually makes our patients better. Follow me for more evidence-based veterinary medicine.